Hey team, welcome to episode 137 of Transition Talk, where we talk about dental transitions and how to navigate the sometimes messy path to practice ownership. The dental industry is constantly evolving, and consequently, so are dental transitions. For instance, when buyers inquire about a practice to purchase, they're asking different questions and looking for different aspects in their ideal practice compared to 5 or 10 years ago. If you're an owner preparing to sell your practice or search for a buyer, then this episode's for you. We're going to talk about what's changed in the inquiry process over the years so you're prepared with the key components buyers are looking for. Joining me on today's podcast is NDP's Practice Listing Manager, Kathy Whiting. Kathy is a true subject matter expert in today's topic as she comes to NDP with a decade of experience in the dental transition field. She has in-depth working knowledge of all aspects of transitions from seller and buyer consulting, valuations, listings, and contract negotiations. With NDP, she focuses on assisting selling doctors who are in search of the ideal buyer for their practice. We're lucky to have her on our team and on today's episode. Welcome, Kathy.
Thank you. Thank you for having me.
Absolutely. So I think that one of the things that is so interesting is you've been doing this for a long time. I've been around here for a few days, and I do see the shift in kind of what people have focused on. And we talked about this a little bit before we started recording, and clearly there are like kind of some main buckets of areas, right, where things are different. I'm just going to kind of throw some out there, and I just want you to give me your insight on these topics. So location, right? Like we're a much more mobile society, I feel like now. How has the location changed from what buyers are looking for these days?
Well, it's just as important to buyers. Location is just as important, but they're more flexible as long as the practice opportunity itself is what they're looking for. Where I would say maybe 10 years or more ago, people were trying harder to move back to family, live closer to family. So they were a little more specific in where they wanted to go, and they were willing to sacrifice the practice end of it for the location. Now it's more they know exactly what they're looking for in terms of a practice, and they have a lot higher expectations, but they're willing to broaden their region or their parameters for that right practice.
Yeah, I can see that. I mean, and I also think that too, from a location standpoint, and we've talked about this on the podcast, you have to be careful if you are a buyer listening that you aren't so wide with where you want to go, right? Because then that's overwhelming too, right? Like I think the buyers that we talk to, maybe the ones that we know are the most serious, that they're flexible like to an extent, right? They're like, we're willing to go to North Carolina or Florida or Texas or this, right? Because of these areas, but we're not willing to go anywhere, name it. So I think you're right that the practice is driving it. Do you think that's because practices in general, maybe it's a little more competitive to purchase a practice, or are we just more knowledgeable, you think? Do you think buyers are just more knowledgeable at what the right practice is?
I think that they are more knowledgeable than they used to be. I think a lot of times before they didn't know what they didn't know. But there's been a lot more opportunity for them to learn all the way through dental school or residency or whatever the case may be for each of them. So I think that they do know what they're looking for because they've been not just educated at those events, the seminars or lunch and learns, but they have also self-educated. So they've compared, contrasted, they've been looking at different types of opportunities, suburban versus rural. Some of them are specifically looking for rural. They know they don't want a lot of competition. Other people know, right where they're looking to be. And I think that a lot of the corporate dentistry has probably impacted that as well. I mean, it's good for them to come out with a little more understanding of what they're looking for.
Yeah, and maybe they've been listening to Transition Talk.
That's exactly right.
So that kind of leads us to more of like the diligence piece too, right? I feel like the diligence game has definitely changed, even from kind of when I started doing this. Talk to me about kind of the then and now when it comes to diligence. Like what is different now than it was?
What's different now, I would say, are the questions that they ask. Of course, that's what due diligence is. But the questions they ask, the types of reports that they're looking for, the information that they assume is going, not just the information, but the equipment even, those types of things. A lot of buyers are coming in with some level of assumption that things are going to be digital and updated and, there's going to be higher end equipment than they ever would have asked for 10 years ago.
Yep.
And so when we come to a practice that isn't computerized or fully digital, or they're both charts and computer, those ones are harder to not so much transition, but to find a buyer that even feels like they have the confidence to handle that? What do they don't know anymore what to do with all of those paper charts. What are the laws, and how long do they have to store them, and do they have to pay extra for a storage unit? I mean, these are things that they don't not used to talking about.
And it seems silly, right? If you're an established doc listening and you kind of remember the, before computers and you're digital and you're kind of looking to transition, keep in mind that, even if a doctor graduated 2, 3, 4 years ago, right? So a more kind of like established associate that's now looking to kind of purchase for the first time, they still went through with a lot more technology. That's what they trained on. Mm-hmm. So that is what they know how to utilize, and that's how they're going to expect to practice, right? So if you don't have that updated equipment, like Kathy said, that's okay. But we're going to have to really understand, like, that's probably going to impact value. Or it's going to be, they're going to offer less than probably what you're asking if it's not priced appropriately, because they're going to have to make the investments in that technology that's going to get it up to kind of what their standard is. So they're not just being kind of like spoiled brats that need, high tech information. It's just literally how they know how to work, right?
Right, exactly.
What about reports, right? So like clearly active new patients, like what are kind of some standard reports that have changed now that we've kind of, buyers are, I guess, getting smarter?
Right. And patient count's still important. It's not that it's not important. It is still certainly important. But there's, in terms of a general practice, for example, more dentists are rendering some of the specialty services, implants, ortho. And so a lot of the young buyers that are out there, the candidates that we screen every single day, they're asking not so much the patient count, but they're looking for a percentage of types of services that are rendered to see if they're the services that they can render are, if they align. Yeah. If they align with what's going on in there. And if not, maybe there's just one or two and they can make arrangements for somebody else to cover those types of services.
Yeah. And then from a referral standpoint, I'm sure that is similar, right? As far as like what type of marketing, there's so much marketing that can be done now. Are you seeing increased questions about just kind of referrals and different types of reports that would kind of give them more insight on that? Or are they just kind of focusing more on the clinical side?
I don't really get a lot of questions on marketing. Probably because most of the information that we ask ahead of time, and that information is right there. Something that is different in terms of marketing is, of course, social media. Where 10 years ago, the sellers that I worked with were not on social media by and large. But now that's usually what a huge part of their referral base is.
Yeah, I think buyers are being smart in the fact that they're going online and doing some diligence on their own of just what does their website look like? What does their social media look like? What are their Google reviews? So if you are a practice that doesn't have those things, sometimes it can look like a red flag, even if it's not, that you don't have any online presence. Now, I would say that if you are a buyer and you look and there's no website or social media or Google reviews, it could just be an opportunity to create those things and grow it. It doesn't necessarily have to be a red flag, but if you're thinking about selling your practice in the next 3 to 5 years, definitely something to kind of consider there.
Absolutely.
What about production collection trends? Clearly still important, still want to understand what those look like. How have those types of reporting and kind of diligence aspects changed in the last 10 years?
One thing that I have noticed is that fee-for-service patients aren't always taken as a good thing. Where before it was absolutely, at least my experience is, fee-for-service patients were absolutely a good thing because you didn't have to discount your rates for the insurances and the contracts that they're working with. But that's one thing that I've seen a lot more acceptance of the PPO rates. And I think another side of that is that they're maybe concerned that if a doctor is fee-for-service, people are coming specifically for that doctor. So then maybe they're at risk of losing those patients once the doctor's gone.
So from a transition standpoint, like how do we mitigate for that a little bit?
I think one of the most important things that we can do in terms of patient retention is to handle the entire transition as confidently as possible on the front end. And then once the transition itself is going through and maybe the doctor's going to stick around for, a month or two for the sake of that transition, how that is handled, the verbiage in the patient announcement letters, working with the staff so that they understand how critical it is to be positive. And when they introduce the new doctor, the staff plays a huge role in that. And I think that's something that a buyer can prepare as well as the seller, as long as those pieces are mapped out ahead of time so that they're not forgotten. And then all of a sudden the staff is taking calls and they don't know how to answer it. And, just need to be prepared for those conversations.
Oh, yeah, I can definitely see that. And then I think, too, like I have seen an increase in the reports that we get that are kind of a little bit of the one-off, like unscheduled treatment and like how much of X are you referring out? Why do you think that is? Like, do you think that people is it they know more? Are they looking for ways to improve? Like, why do you think that lesser known kind of reports? Sometimes our clients don't even know how to run those reports because they don't really look at those. But what do you think the reasoning for that is?
I think they're looking for lost money. An opportunity once they take over, they could collect or capture what isn't being rendered in the office. And so if there's a general doctor or a general dentist that is referring most the crown and bridge out or their third molars, that's good to know that they can account for that. It doesn't increase the value. They're not going to pay more for it. We don't,
Yep.
We're not going to value based on potential. Yes, we're not going to make a value on potential, but it does help them. And it is good information. Sometimes even the banks will ask randomly those kinds of questions.
Yeah. And I think, too, like understanding that from a overall standpoint, people have had and heard stories, right, of people not asking questions and kind of being surprised or having a bad post-transition experience because they bought the accounts receivable and they didn't ask enough questions about it. And turns out it was all really bad and they spent their money on something they're never going to collect, right? So now people are paying more attention to some of these other areas. If you are a seller and you're listening, I think it's important to kind of hear what Kathy's saying and kind of what we're saying about these buyers, right? Because I think it's important to these things, right? When we say, hey, what is your unscheduled treatment or what are you referring out? Like those are some things that sometimes, especially the referring out, sometimes doctors don't track that. They just say, oh, I just give out a lot. And they're like, well, what is a lot? Or, but like, if you know you're going to be transitioning, those are like really great things to highlight because if you have someone coming who has worked in a more multi-specialty type GP practice and they have the ability to do more of those things, that's going to look attractive to them because they're like, oh, if I can keep doing this and do implants and keep all endodontics in the office, that will be great. Like they can see that and it's going to make your practice more attractive than maybe a competitor. So I really like that angle. And I love that people are being smarter and figuring out how to make more of something. We talked about equipment a little bit. Clearly, those things are all really important. I'm sure that the milling machines and just some of the technologies, scanners, lasers, like those types of things clearly are different than they used to be. Do you ever feel like maybe practices have done too much of that and it's not as enticing to buyers as they want it to be, maybe like too much improvement?
Yeah, especially if they've gone out right at the end when they know they're getting ready to transition and they're buying a brand new CBCT or whatever just to look like they're up to date. I feel bad for those sellers that they have spent so much money because it's kind of like putting a pool in before you sell the house. You're not going to recoup that.
Not going to get all the dollars. Nope.
Yeah. So unfortunately, that's something that I think that sellers will make a mistake on. And I don't think that there's a buyer that's ever going to complain about it. But most importantly is just if the office is digital and it's up to date in that capacity, do you need extra machines, extra equipment, extra this and that? No.
Not all the toys and bells and whistles. That's
right,
what you're
exactly
saying.
right.
Need all
Thank
of that.
you.
It needs to be a well-run, efficient, up-to-date practice. Right. That's
and
what
if
we're
they
going
really want to get some of that, then they most definitely will.
I was at a speaking event this weekend and I had a lot of questions about the building, right? Like the facility. And I feel like that has shifted a little bit too.
Yeah.
What are you seeing when it comes to the building, like lease versus own? Like what was it then and kind of where are we today?
Well, before, I didn't always get questions on, is the building going to be for sale? Am I going to be able to purchase the building or the unit or whatever at some point? But sometimes I did, but it's a regular question now. I really do think that because buyers are more educated, they know exactly what they're looking for. They know better. And that's just the bottom line where people before, they would take what they could get and they would ask what they could about it. Like maybe is there room for growth? Is there an opportunity for growth in maybe one operatory? Or, they're just curious a little bit about growth capacity, but not necessarily ownership. And so I would say now that's a main question. They'll also ask more details like signage and can they renegotiate rather than just take a lease assignment? Can they renegotiate? They're just not afraid to ask more questions.
Yeah. And I think too, like the growth ability, if we're looking at a practice that doesn't have any room to expand, I feel like buyers are being smarter about like, okay, are there additional units?
Thinking outside the box.
Yeah. Like, can I only get a 5-year lease so that I can make sure I can move it when I grow it? So like they're really kind of planning ahead from a space perspective, which is, I do feel like that has changed. I don't know if there's been more podcasts or they're focusing more on taxes, but we do get the question a lot of like, oh, like, is it bad if I can't buy the building, right? Like if it's just someone who leases or they currently never have the desire to sell the building. And so I think it's an interesting kind of time with them kind of just being so forward thinking about the space itself and kind of wanting that ownership of that space.
They are definitely looking ahead, not just at buying what it looks like today. They're looking at what does this practice look like in 5-10 years as well.
Anything else that we've covered like a ton of areas and topics already, but is there anything in particular that kind of surprises you still when you get questions, from buyers? Not to put you on the spot here, but anything you can think of. You've talked to a lot of buyers, all of our listings currently, you kind of manage those, but any questions that are like still kind of surprised by today that get asked that you wouldn't have got 5-10 years ago?
I would say where previously they would expect a seller to stick around for maybe a couple years, they're not as needy in that way. They would like them to stick around for the sake of a smooth transition. But ultimately, I think they're coming out with a lot more confidence in their production ability. And so they're really just looking for the seller to help them in terms of the goodwill and get that transitioned well. And then they would like to pick up the production themselves.
And I'm sure that's also a function of student debt is more. And so people are waiting a little longer to purchase. And so by the time they become a buyer, we're kind of talking like they come out of school, but most of our buyers are not, even out of residency, right? They've practiced probably at a few times, few different practices. They've really kind of tried to figure out like, what do I like? What do I want? Which is probably kind of what's driving a lot of these changes that we're seeing is them being more confident and knowledgeable and just ready, right? Like versus kind of 10 years ago when we did see right out of school, right out of residency, ready to purchase type buyers. Yep. And I think from our perspective, right, like we have a unique position at NDP. We have our listing service, which you manage. We also have our buyer consulting and seller consulting. So we see both sides of this coin and we see buyers as they come through our listings and then maybe whatever practices we have aren't a good fit, don't fit with their boxes. And so then they kind of come back to us as they found another practice and through buyer consulting services. So I think that it is a changing landscape. I laugh and I'm sure you do too. And I hear people say that like private practice transitions are dead. And we're like, well, we're sure busy for it to be dead, aren't we?
Yeah, it doesn't feel so dead to me.
We might feel dead, but it doesn't feel dead. But yeah, so I think that what's important for you if you're listening from a selling perspective, if you're considering a transition, it's really, really important to kind of look at your practice with a critical eye, ask the questions, make sure you can pull the reports, be prepared about what you are offering, right? Again, we know your practice is special. We know it's important, but we want you to be able to show the reports and show the data because that's what these buyers are wanting, right? We're a data-driven buyer pool that we have here and they're wanting to know. So being knowledgeable about that, being ready to answer those questions and not being put off when you get those questions, right? Sometimes I think sellers are annoyed by the level of questions that buyers have these days.
Say it's not applicable.
Yeah, not applicable. Doesn't matter.
It matters.
It matters, And at the end of the day, if it matters to the buyer, it should matter to you because what we're trying to do, ultimate goal, transition the practice. And if you're a buyer listening to this, I think if you're not asking these questions or don't have a team, then clearly we can help you with that. But really kind of making sure you're educated about what you're about to put your name on from a practice perspective is clearly really important.
And don't make the mistake just because you attended a practice transition seminar 10 or 15 years ago that you know what's going on today. I would definitely recommend updating your information because things really have changed.
I love it. And we happen to host some of those. I'm just throwing it out there that we happen to have a resource to get you back on the education train and make sure that you are prepared for whatever's coming your way. So thank you so much for joining, Kathy. I appreciate it. You'll have to come back. We'll have to come up with more topics. This is fun.
Yes,
fun
absolutely.
to get out from in front of our computers and chat.
100%.
Well, thanks, guys. I appreciate you listening. Thanks for joining us on episode 137 of Transition Talk. As always, make sure to share the transition love with those who may not know of us yet. And of course, subscribe wherever you listen to your podcast. Until next time.